You ready? I feel nervous. Okay, so first MTP joint, right? It's the bone in between that first phalange and your first metatarsal. So it's this joint right here, and you can kind of wiggle it and see where that joint line is. First MTP joint, right there. First metatarsal, it's the long bone on that medial side that comes down from that MTP joint. You kind of feel it come down and across, and where it kind of meets up with that next tarsal. But first metatarsal right here, just this long bone. First cuneiform, that's the first one you're gonna hit at the end of that first metatarsal, right before that navicular, okay? So if you hit that navicular, you've gone too far, but it's gonna be right there. First cuneiform. And then we continue past that, and we hit the navicular and the navicular tuberosity. So navicular is the bone, and you can come on top and kind of feel it as well, but that bump on top is the tuberosity. Talar head, it's going to be right on top, and you can feel it. You have these kind of dimples on the top of your foot, so you can stick your fingers there and bring them into a little bit of dorsiflexion and kind of invert and evert, and you can feel that head kind of come in and out, right? So it's just that bony outbursting right where your fingers are in those dimples. Sustentaculum tali, if you come over, so we'll come down from the medial malleolus and drop down. It's going to be right, it's on the calcaneus. Yours is hard to feel. But it's right underneath that medial malleolus on that calcaneus, right? There we go. Okay, calcaneo-navicular ligament. It's exactly what it sounds like. It connects the calcaneus to the navicular, right? So it's just going to be a connecting ligament right there. Can't really feel it, but if you put a little bit more stress onto that by everting the foot, you can kind of feel it tighten up a little bit, just connecting that calcaneus to the navicular right there. Calcaneo-navicular ligament. Medial talar tubercle. So this one's near the sustentaculum tali, just a little bit more proximal to the body. Again, it's if you go down from that medial malleolus and kind of, you can force them into a little bit of dorsiflexion, and it's going to be right behind it, just a little bone sticking out that you can feel that medial talar tubercle before you hit the sustentaculum tali, okay? Calcaneus, the big honking bone, the back of your foot, you can just grab onto it. Medial calcaneal tubercle. So this one, you'll come down the calcaneus, and you have all that tissue right there, but it's just that angle as you wrap around underneath onto all that tissue. It's just kind of that bump that you feel as you hit all that tissue. Flexor hallucis longus. So it's going to be on the bottom side, and it wraps around that medial aspect of that medial malleolus. So you can have, somebody go ahead and push against my finger. So you can kind of see it pop up right there. There it is, popping up. And it comes down, wraps underneath, attaches to that, that first, the big toe, I don't know. Okay, tibialis posterior tendon. That one also is going to come and wrap around. You can kind of resist, push on the inside of my hand. You can kind of see him pop out. Same deal, comes from kind of the backside, wraps around that medial malleolus, and wraps down underneath the foot. So it's just going to be doing some everting motion that you can see kind of pop up. There we go. Flexor digitorum longus. So the other digits, excluding your big toe, you're going to have them push down, push. You can kind of, if you keep your fingers there, you can kind of feel it pop up a little bit more, but it's going to be along with those other two muscles that wrap underneath, down that medial side and posterior. So, I mean, we always talk about Tom, Dick, and Harry, It's just tibialis posterior, digitorum, flexor digitorum, and then hallucis longus. Okay, so Tom, Dick, Harry. Those are the medial ones. Let's see. Posterior tibial pulse. So it's going to be right behind that medial malleolus. So I don't know what else you want me to say about that one. Okay, lateral structures. Okay, we already went through the first MTP joint. Fifth MPT is just at the, we've got our first phalange of that fifth, and then that fifth metatarsal, right? And you can kind of, if you bend it, you can kind of see where that joint connection is. So it's going to be right there. You think it's up there, it's not up there. It's a lot lower than you think it is, okay? So to really find it, bend where that phalange is, and you can really touch it. Fifth metatarsal, coming down from that joint, again, it's the long bone that comes right there on the lateral side. Styloid process is just on that proximal side of that metatarsal. You come down and it drops off. That's the styloid process right there. That's poking out. Cuboid, so coming down, hit that styloid process. The bone right after that is the cuboid. Lateral calcaneal border, so we have the calcaneus, and it's just that border before that drop off, okay? So just that angle between that lateral side and the inferior side. Peroneal tubercle is on the calcaneus. It's where the peroneals come and wrap under. So it's right below that lateral malleolus. And you can kind of feel just a little outcropping of a bone where the tendons kind of wrap anteriorly to it. Oh, where am I? Peroneal tendons. Okay, so we have longus and brevis. Longus is going to come up a lot higher on the fibula, and then brevis is going to be a lot lower. They're both going to wrap around that lateral malleolus to your fifth digit, and the longus kind of comes underneath, but they both connect to that fifth metatarsal, and you can kind of push out. And you can see those muscles popping out and kind of see where it leads. You can see that leads you right to that fifth. Okay, dorsal structures. We've got our rays. So those are just like the spaces in between those metatarsals. Our cuneiforms, we kind of touched on that for a second, where we came down that medial side, hit the end of that fifth, we had our first cuneiform, and then if you come up over top, you can kind of feel the difference of the three other ones, or the two other ones, I guess. So you can just come down to the end of those metatarsals, 2, 3, 4, and kind of feel where those other cuneiforms are. But the first one that we feel the most is just right there on that medial side. Okay, navicular, right? I like to come down and find it from the medial side, and then you can just shoot straight, I guess dorsally from that, and that's the big honking bone. That's right. I mean, you can grip onto it, but I just like to find that navicular tubercle first, and then you can kind of follow it up to where it is dorsally. Dome of the talus. We kind of found this when we found the head of the talus. So it's just, if you force them into a little bit more dorsiflexion and stick your fingers into those dimples, you can kind of feel the top of that bone, which is where the dome of that talus is. Sinus tarsi is on that lateral side. So if we find kind of where that talus is and drop your finger down, you can kind of feel an empty space, and that is right where that sinus tarsi is. And you can bring them into a little bit inversion if you want, and you can feel that space open up a little bit more. The sinus tarsi is just an empty space. That's all it is. It's not a bone. So it's just an empty space. It's a sinus, if you will. Okay. Extensor digitorum brevis and extensor hallucis brevis. So extensor digitorum brevis, it's on the digits. It's going to be on the lateral 4. It's on the extensor side, so it's going to be on top, right? So you can have them resist against, and you can see those tendons popping up, and they come up kind of onto that lateral side. And then the extensor hallucis, you can extend, and you can see that tendon pop up, and it comes up there as well. Inferior extensor retinaculum. So it's going to cover those extensor muscles, right? So we just found those. It's going to come up from the outside and just wrap around in front. So pull up. Sometimes you can kind of see the tendons are really popping out right here, and then it's kind of a little less right there. That's kind of where that retinaculum covers. It's just a covering of those tendons to kind of hold them in place so they're not free flying everywhere. That's just what a retinaculum is, just a covering to hold something in place. Tibialis anterior, go ahead and pull up again. You can see this tendon popping up right here, and you can see that it's this muscle that pops up and follows it down, just this big one. So it's not your hallucis longus, it's the one just medial to it, okay? So it's on the anterior side of the tibia. A lot of these things are going to tell you where they're at just by their names, so you just have to break it down a little bit. Extensor, hallucis longus, we did these ones. Okay. Dorsalis pedis pulse. So it's just on that dorsal aspect, and I always have a hard time with it. But it's just kind of right in the middle. Sometimes it's a little bit more medial, but it's just right on top of where it is. Make sure you're not using your thumb. You'll probably get docked points for that. But that one's you should probably practice on each other to really find it. Because some people are going to have really strong ones. Some will have pretty just like shallow ones. But it's, I mean, it's right on top. Okay, plantar structures. We already did that one. Plantar fascia. So if you force them into dorsiflexion, it's just the tight fat. Are you ticklish? Okay. You have to get over it. It's the holy cow. It's the tight fascia that's right on the bottom. So I mean, if you relax them and then force them into dorsiflexion, you can feel it tighten up. But it's, I mean, it's literally just chilling there on the bottom of their foot. Lateral 4 metatarsal heads. You can kind of force these last 4 phalanges to pop out, or force them into extension. And you can go along just kind of like the pads of your foot and feel where those heads are. And I mean, you can follow those toes down to kind of stay in line with them. I'm sorry, he keeps on curling away because he's ticklish. But yeah, if you force them into a little bit of extension, that'll force them to pop out a little bit better so you can really feel where those heads are. Okay, sesamoid bones of the great toe. Just little tiny bones, just kind of where that MTP joint is, right? We found where that MTP joint is. It's just going to be right on that head. And you got to push a little bit hard, but you can kind of feel some change in that bone where it feels like there's a little bit of an extra bump. It's just those little tiny bones, those sesamoid bones. Okay, common peroneal nerve. It's a nerve that comes down just that fibular side. It's next to the peroneals, right? We went over the peroneal muscles. So if you break it down that way, just know it comes down that fibular side with those peroneals, just kind of around that fibular head and down. That one you can't really palpate, but if you push hard enough, I guess you could get a response. I'm not going to do that. Fibular shaft, long skinny bone on the outside. You can start from the lateral malleolus and come up to that fibular head. The shaft is just that medial part, or sorry, that lateral middle part of those two outcroppings of the bone. So you can kind of feel, if you want to palpate this way, just by pushing your fingers in through those peroneals, you can do it that way. But just know it's in between those two landmarks. Okay. Anterior and posterior tibiofibular ligaments. Again, the ligaments are pretty hard to actually palpate, but it's good to know where they are. This one explains exactly where they are. Anterior tibiofibular, you have your tibia, right? Big bone right here. You have your fibula out here on the lateral side. Anterior, it's going to connect it from that bone to this bone. It's underneath those muscles. So it's not the retinaculum on top. It's the ligament underneath that's just connecting those two bones in the front, okay? Posterior, yeah, curl around. It's going to be connecting that posterior aspect of the fibula to that posterior aspect of the tibia. Again, it's underneath a bunch of muscles and other tissues, so you can't really palpate it, but it does connect posteriorly the tibia to the fibula. Okay. Interosseous membrane. It's the connecting membrane of the fibula and the tibia. So I think it's kind of best if you point out where the fibula is and where the tibia is, and you can say like it's right deep to these muscles right here. So you can use the anterior tibialis. It's just deep to that, connecting the shafts of the tibia and the fibula together, right? You can't really palpate it because of all the muscles. We already did peroneals. All right, lateral ankle structures. Okay. We have our lateral malleolus, right? Just the bone that's sticking out there. It's part of the fibula. The calcaneofibular ligament. So calcaneus, fibular, the fibula, connecting the calcaneus to the fibula. It's a ligament that's coming right up. So, you can kind of force them into a little bit of eversion to create that a little bit of tautness with that ligament, but just know it connects the calcaneus to the fibula. Where am I? Redid the... Oh, anterior talofibular and posterior talofibular. So don't get confused between tibiofibular and talofibular. Talofibular is the talus, okay? So it's going to be connecting the talus to the fibula. Anteriorly, you'll have it, you can't palpate it, but from the anterior side of the fibula to the talus, and then again, posterior fibula to the talus right behind. So, in there. We already did tibiofibular, right? Yep. Anterior tibial shaft, shin bone, the nice sharp bone that you have in the front of your leg. So, just go along that long ridge. All right. Medial malleolus, part of the tibia, just the opposite of the lateral malleolus, right? And then deltoid ligament is kind of a network of ligaments. So if you force them into a little bit of that eversion, you kind of feel those those ligaments tightening up. I think this is the easiest ligament that you can feel compared to the other ones anyways. So, if you force them into that eversion, you can kind of feel those ligaments get a little bit more taut. But it just kind of connects from the calcaneus up to the talus. Okay, flip over. Onto your stomach, yeah. Neat. Okay, so posterior structures, you have your gastroc, which is the big meaty muscle that you can see mostly on top, so push down. You can kind of see those muscles poke out, right? So you'll have your medial and your lateral head of that gastroc. Lateral head, obviously, and medial head. And then the muscle that's just distal to that is more of your soleus. So just know this one up top is gastroc. This one below is soleus. But the soleus is underneath the gastroc, so the soleus doesn't just stop right there. It does continue up just before that knee joint, whereas the gastroc comes and crosses the knee joint, okay? The The Achilles tendon, you have those two muscles come together to create this big fatty tendon in the back of that heel. Subcutaneous calcaneal bursa. So subcutaneous is just under a bunch of tissue on the calcaneus. And the bursa is just the fluid-filled sac. It's just right on that heel. And then your calcaneus, right? And then subtendinous calcaneal bursa. It's going to be right next to that subcutaneous. It's just underneath that tendon, in between the tendon and the calcaneus, to kind of prevent the friction that occurs during ankle motion. So it's just going to be right there. Okay, that's that one.